Welcome to the Aortic YouTube channel. You are watching the African Cancer Research Corner. I am Professor Folakemi Odedino, one of the scientists anchor for the channel. I also have the privilege of serving as chair of the Aortic Research Committee. As a research-focused organization, we work very closely with sister organizations in Africa. Our program today is a conversation with one of the sister organizations, the African Cancer Echo. Please join me in welcoming Dr. Nkaganda. I'm going to ask her how to pronounce her name. I'm so sorry if I'm mispronouncing your name. And Dr. Lasebikan, please introduce yourself to our audience, starting with Dr. Lasebikan.
So my name is Dr. Lasebikan. I'm a clinical oncologist at the University of Nigeria Teaching Hospital in Enugu. I'm also a member of the Aortic Research Committee and the chair of the African Cancer Research and Control ECHO program. It's a pleasure to be here.
Thank you. You are, okay, go ahead.
Yeah, I'm Annette Nkaganda, a clinical officer and a cancer epidemiologist based at the Uganda Cancer Institute. I lead and manage the cancer clinical trials at the Uganda Cancer Institute and also responsible for conducting epidemiological investigations for cancer control in Uganda. I've participated in cancer research for now almost 15 years and in Africa. And in this capacity, I've been chairing the Africa Eco Steering Committee for the year 2019-2020, and I've been a member of the Africa Eco since 2017. So I'm really honored and pleased to be here to discuss further about cancer control and research in Africa with the Aortic group.
Awesome. So we have some really powerful African women here. So I'm really looking forward to getting to know more about their organization, as well as getting to know more about them. So I'm going to throw all these questions out there, and please feel free for either one of you to answer the questions. So first of all, can you tell us a little bit more about your organization? For example, when was it founded? Why was it founded? Where are you represented in Africa?
Yeah, so the Africa Cancer Research and Control ECHO is a training group mainly composed of African countries. And this group was established initially by the NCI Center for Global Health, having to see the need for using evidence to direct the cancer control efforts. They started this effort to make sure that they really facilitate this in Africa. So this started in 2014 with physical meetings, about 4 or 5 people involving the, by then, were nominate cancer control leaders in Africa. And since then, it went into the virtual network, a community that is aimed at increasing this knowledge, familiarity, and utilization of national cancer control planning principles and strategies in controlling cancer in Africa. And also to strengthen the interaction of researchers, you know, with advocates, with clinicians, with the politicians, and so that we share and educate about the research with all the stakeholders when it comes to cancer control. So basically that's it. And as we share interaction more, because personally I remember I attended one of the courses, but our experience is to make sure that we multiply, we expand the best practices to all cancer control experts and encouraging them to always base their decisions, their interventions, their strategies on research.
That is very interesting. So, I mean, and a very much needed area as well when you're looking at cancer control, and the fact that it's very important for each African countries to have cancer control plans, as well as have a way to implement those plans. So can you tell me what are some of the key accomplishments of your organization so far?
So just to extract some of the things from what Dr. Nkaganda had said, one of our objectives include to expand and sustain best practices for cancer control planning and implementation, specifically around policy and practice, and to also increase the utilization of evidence-based interventions in directing cancer control in Africa. So spinning out of those two, one of our greatest accomplishments have been in creating opportunities for country-level participants to receive concrete technical assistance in cancer research and control efforts. Example include sharing tools for costing during the development of their national cancer control plans, linking the participants to technical resources to support actual development of the national cancer control plans. And I think the other thing would be to say that we have managed to provide a platform for researchers to share their findings and recommendations to their key target audience and policymakers alike who need this evidence in order to work on scaling up interventions from the pilot phase to practice. I think another accomplishment that the African ECHO has had is in raising awareness to the global community about the expertise and knowledge that exists already within the African region and the vast opportunities that are abound within the region, and to be able to also leverage this with what is going on and how we can partner with other countries and regions such as ours in order to further enhance the cancer control plans. I think by and large, these are essentially our key accomplishments over the years.
Yeah, that is great. So I want to ask, a follow-up questions. As an African in the diaspora, one of the challenges that I've seen is, while some of these countries do have cancer control plans, there's really sometimes the problem lays in the implementation strategies for those plans, right? What are some of those barriers that you feel your members face in implementing cancer control? So this is a follow-up plan. And how is the organization helping in addressing these barriers?
So I think one of the barriers is in the technical expertise and also the ability to conceptualize the implementation strategies and frameworks that would be able to transition them from the plan to actual implementation. And I think this is where the organizations in diaspora can actually help to lend a helping hand in offering the technical nitty-gritty know-how, and also to perhaps build capacity along the implementation science that will help to entrench these cancer control plans, and then we can move forward from the drawing board.
Sounds great. So next question, what do you see as the greatest impact of your organization to cancer research in Africa?
Well, I think providing a platform for researchers to share their findings and recommendations to their key target audience is key, and also to the policymakers who need to really understand what is going on at the various country levels. But also the impact is that people actually walk away with research questions, having listened to what is going on in other countries, experiencing similar challenges, and then they're able to develop potential research questions that are locally relevant and will contribute directly to improving the systems, access to care, and eventually patient outcomes within the region.
Yeah, in addition to what Amaka has really said is, although it may be difficult to really point out and tag achievements specific to the Africa ECHO, but as you see, through this intervention, we have seen that the number of countries in Africa that have now a written, well-conceived national cancer control plan has really increased. In 2013, it was about 46%, but by 2018, it was 74% recent data. And I know it has now reached to about 93%. So you can see that at least many African countries are really aware that it's high time we stopped implementing cancer control strategies in an ad hoc manner, all depending on what the politician wants or the funder. It's high time to sit down, use evidence of where we are and where we want to go and how are we going to reach there and put it in writing. So I think Africa ECHO has contributed partly to this achievement in Africa. And our aim is to make sure that we really continue having this dialogue and make sure that we don't only stop at writing and putting the national cancer control plans on the shelves, but we go ahead to implement them. And it means really a lot. Again, empowering our African cancer control leaders when it comes to costing these national cancer control plans, and not only costing, but have resource mobilization strategies for it. As you all know, cancer is one of the things that is too expensive. Every bit of it, from prevention, diagnosis, treatment, palliation. So we cannot rely on only governments to fund, but we must have skills to mobilize resources towards achieving some of the things. And also, in addition to that, one of the achievements is something that where members indicated in our recent evaluation survey, that they feel now a sense of belonging to a community of cancer control leaders. Before, it was really very difficult. You either knew your colleague through schooling together, or meeting them around the conference, or doing a joint research project or program. And fine, there was nothing like this continuous chatting together. Hey, what happens? For example, with the recent COVID-19 pandemic, we were on top of everything because we just switched our sessions, and we even made them every week. During that tension of lockdown, we are all at home. We really felt we had a community to discuss with what is going on, what is about this new disease, what do we do with our cancer patients, what can we do, can we hold screening, so that sense of belonging and having experts to keep on brainstorming with on daily basis is really a very great achievement. It does only improve our services in cancer control, but also our mental health. That I can now just send a WhatsApp to Amaka, to Flora, and say, hey, what is happening? So that's a very great achievement. And another achievement is we've really engaged our partners actively in African issues, and having that 1 hour weekly or monthly that is directed at discussing our African issues. And in that process, people have come to learn what is happening, that Africa is not actually a one country. There are different countries, very unique countries, very unique challenges to the countries. And we have had one of the countries like Burundi now has got partners coming in through the Africa Eco Sessions. We got the partners that are now working together, 4 or 5 of them, to really make sure that cancer treatment is taken to Burundi. Before, Burundi was relying on neighboring countries like Kenya and Uganda. So we really have so many achievements, and we hope that we are going to have so many achievements as a result of this continuous learning process and engaging partners in a continuous networking process.
Congratulations on all those achievements. That's really impressive, given that your organization is less than 10 years. And so this is a very, very important area. Implementing those cancer control plans is really, really, really important. And one of the areas of science that is not just emerging, but it's been around for a while, is the area of implementation science. And this area is also of significant interest for my organization, ARTIC. So let's kind of talk a little bit about how your organization is involved in implementation science and what you are doing in the area of implementation science. But for our viewers who may not have an understanding of what implementation science is, can you explain what implementation science is to our audience?
Amaka, do you want to take a go?
Okay. Okay, so in a brief, just to put it very mildly, implementation science is the study of methods and approaches that promote the uptake of evidence-based interventions into routine practice and policy making. Now, studies have shown that, it takes as much as 17 years to be able to translate the knowledge that is gained from randomized control trials or very well spelled out, laid out research trials into the practice. And so I think we shouldn't wait that long to be able to reap the dividends of this rigorous research. So this is the area where implementation comes in very strategically, so that we can begin to translate all these interventions and all these activities, the knowledge that has been gained, into practice. So in a nutshell, I'd say that's what implementation science is, broadly speaking.
Very well defined. Thank you. So why do you think implementation science is so important for Africa?
Well, it's because this implementation science translates both to service, the care delivery, and ultimately to the practice and outcome. I think it is really essential for Africa to be able to be doing implementation science research. For one thing, it's cost efficient. If you are able to deliver interventions that have been proven to work. For a country that has limited resources, we are able to conserve as much as is possible and channel it into the right directions through implementation science interventions. And I also think that having interventions along the cancer spectrum, as Annette had mentioned earlier, since our priorities across the cancer continuum, having implementation science strategically at certain points, perhaps the prevention area. I mean, our resources are limited, so we should be able to prioritize where our funds should be able to go to. So having it in the area of prevention science, I think, would be great. So I think these three areas are important in implementation for us to be considering implementation science in Africa.
Thank you. So what are some of the activities that you are currently working on with respect to implementation science?
So this is a big one for us. We are currently partnering with the AOTIC and also the African Behavioral Research Community, and also with the NCI to try to develop, well, not necessarily develop, because the ABBA group is already utilizing a curriculum to train implementation scientists across some West African countries, Nigeria, Ghana, and Cameroon. So we're going to try to duplicate this effort across our network, our wide network. And I think this is something that is very exciting for us, because we can quickly multiply the number of implementation scientists across Africa, and so that we empower them to go into their own communities to begin to do research, strategically trying to find out what works within their own societies. I mean, we've had situations where we have very well drawn out demonstrated, we have very well drawn out rubrics of intervention that have not essentially been effective in our own climate. So having this program will empower our scientists to be able to, first of all, understand what implementation science research is, and hopefully equip them with the ability to develop and test Afrocentric interventions that will actually be useful within our community. So like I said, it's a very exciting session for us. We're really looking forward to that training, and we thank AOTIC for leading this.
Yeah, in addition to what Amaka has said, is a number of activities are taking place. As Amaka has taken over the leadership of the African ECHO, as the outgoing chair, I'm currently working on writing the publications, and they will be out soon, about 2 for the previous year. One is really an exciting one because it involves the results of the evaluation of the ECHO, how it has fared, but also it evaluates the achievements at the leadership, skills and the cancer control principles at an individual level. Individual participants really ranked, did the self-reflection and self-appraisal, and they rated themselves how they have benefited from the Africa ECHO for the last 1 year. And at the same time, this publication is going to share some experience, what has really worked for African countries. As we all know that evidence is more than research evidence, but also experience, from expertise is very, very, very important. So we are going to get 2 cases from African countries one has really successfully developed its and written its national cancer control plan over the period, and they are going to share what they have gone through, the bottlenecks, and how they went over it. So that is one of the things that we are really doing. Another one is actually sharing, another publication will be sharing our experience when it came to COVID, a pandemic, how we really handled it, how we shared knowledge among the African cancer control leaders, and what are the pressing issues that really are pressing in Africa. So it analyzes those discussions qualitatively, and it is going to bring up the issues that we really want the African cancer control leaders to really know, as well as the partners, as the main challenges from the Africa cancer control leaders. So that's also another achievement we are going to do. And continuously, Mark, I know we document in publications so many at the end of this coming year, and so many others.
Awesome. I mean, that's really, I mean, there's a whole lot that is in the pipeline. And I know in answering the last question, you did talk about what you are doing in the area of training, working with the ABBA Center and the and aortic. So this area, especially for implementation science, enhancing and increasing the number of biomedical scientists that are really focused on this area is very important. Is there anything else that you want to add with respect to maybe other things that you're planning to increase the workforce for implementation scientists in Africa?
Yeah, what we are really planning, as Amaka has said, is really to make sure we tap into all the existing opportunities that are around, and making sure that we increase the knowledge of what is out there. As you might have attended, our recent discussion was with the ICRP, and we really want to analyze what is already in Africa, what is missing, and what do we need to see being funded. So we look forward to making sure that not only having the National Cancer Control Plan, but when it comes to research and the implementation science research, do we have a research agenda at all levels, from the continental level to the country level, institutional levels, and to the district levels, so that we are driven by evidence of what works and why do we need it. So that is really a very important point we really want not to take lightly, and something we can easily do within a year or two. So it is something we really want to emphasize in the coming few years, that actually it really happens. And working with aortic, especially with your committee, I know this is going to really be easily achieved, that we start to see what needs to be done. And from the discussion with the ICRP and other funding agencies, they're happy to really being driven by the African agenda, and they're looking forward to really seeing it coming out, and they're willing to partner with us and work towards fulfilling that agenda. So that's what I think.
That is great. So before we wrap up, one of the things that we like to do is want you to talk about what is the benefits of being an aortic member. So yeah. Start with Dr. Lasebikan, who is wearing 2 hats. She's now going to be leading the African Cancer Echo, and she's also on the Aortic Research Committee. So tell us what has it been? How long have you been with the aortic, Dr. Lasebikan, and how has it been for you?
I've been with the aortic since this is 2020. I'd say 2016. That was the first time I went to aortic. I think that was in Morocco, and I've benefited so much from being a member of aortic. I know that I think it was in 2018, I was part of the African Cancer Leadership Institute awardees, and that opened me up to a new horizon, you know, and it's been very interesting. It has helped in greater understanding of some of the problems and opportunities for us to grow within Africa in the context of cancer control. And of course, being a member of the ALTIC Research Committee has really been an exciting journey. I'm part of the subcommittee that had to develop the strategic work plan. And I felt that, you know, having to look at so many areas that needed intervention in Africa and to critically prioritize that and decide which were low-hanging fruits and which ones are actually achievable within such a short time frame was a very rewarding experience for me. And I think that I'm able to bring that to bear as I begin to lead in the African Cancer Control Echo Group. So I definitely encourage everyone who is a cancer specialist who is not yet in IELTIC to join IELTIC. It has so many opportunities. Network is increased. I mean, you have, like Annette said, you're able to reach so many people. If there are issues here, you have the opportunity of reaching out to those that have actually gone ahead of you and then be able to tap into it. Oh, another thing I forgot to mention was that being in one of the special interest groups in IELTIC, which is the Young African Oncology Research. So we have so many like minds coming together, and you find out that some of the challenges that you're experiencing are not just unique to you. And then during those conversations, you can actually find innovative ways to be able to come out of that, overcome your challenges. And for us in Nigeria, career options are somewhat limited. But then with interactions with African or other African colleagues, you begin to see that there's a wide horizon out there. You know, you develop interests in various fronts, and you're able to narrow it down to what really works for you and where you can actually lend your voice or make an impact. So, I mean, IELTIC is really a great place to be. And I could go on and on and on and talk about the many benefits of IELTIC, but I will just stop here.
Thank you, Dr. Lashe. Yeah. You are a great ambassador for your organization. So, Dr. Nkaganda, do you have anything to add?
Yeah, of course, IELTIC, it is something that is really very exciting. I joined IELTIC in Rwanda, the one that was in Rwanda. It was 2018.
18, yeah.
Very exciting, but I heard about IELTIC way back before. My colleague really won a big cat grant, and and it's like, what is this? And IELTIC, what is IELTIC? And the big, so a big cat was a very big cat, and for us, and I heard about IELTIC, and that's how I started joining. And in 2018, I submitted my abstract to them, and actually were accepted. It was a very good experience in Rwanda, and in 2019, the same, I submitted an abstract and it was accepted. So, and in Rwanda, we're about 10 people from my organization, the Uganda Cancer Institute, but because of the good things with IELTIC in last year, we were like 30 of them. So it is really very exciting, and all of us found ourselves there. We just tapped into these opportunities from IELTIC, and everybody was like, oh, I got a travel grant again. So IELTIC has really made it possible for all of us in cancer control in Africa to really be able to come together and be able to discuss research outputs, experience, and see, have a sense of belonging. And the way it is really being done is really great. That it has made all cancer control a multidisciplinary, because we all attended, right from the nursing, the health educators, the counselors, the psycho-oncologists, and then the oncologists, the epidemiologists were all there. So to me, IELTIC is really great, and it brings this sense of belonging to a cancer control community in Africa.
And just one more thing, if I may add one of the benefits, well, Annette,
of course.
You know, it serves as a great platform to catalyze some of the things you would really want to do. I know that last year, during one of the meetings, because one of the things we talked about, the special interest group we talked about, was on mentoring. So I was able to meet somebody, a Canadian, who had already launched a Canadian a clinical research mentorship program in Africa before, in Ghana and Zimbabwe, and this has already been published. And this is essentially for residents. You know, I know when I was doing residency, perhaps I would have looked forward to more opportunities for growth. And so with this clinical research mentorship program, I was able to link up with her, and we now have a clinical research mentorship plan for our residents. So I think that is a good thing that has come out of the AOTIC, because now the residents are able to leverage on some of that learnings that had happened before, to be able to develop research skills and essentially be mentored by other radiation oncologists within within the field.
Awesome. You guys are great ambassadors. Well, disclaimer, I did not pay Dr. Lasebikan or Dr. Nkaganda to talk very well about AOTIC, but AOTIC has really been a great organization and really continues to go strong, and it's such a pleasure to have you as sister organization. Is there anything else that you would like to share with the audience about your organization that we haven't covered?
Yeah, maybe what I want to share, one is to really thank you so much for bringing in AOTIC into the Africa Echo, arena, and thank you so much for working with us. And I really want to say that with the current restrictions with COVID, we think that Africa Echo is really a good platform to use to continue expanding best practices for implementing evidence-based cancer control research strategies and interventions in Africa. And what I want to say is that to encourage people to be in such committees, innovations, as we all know that implementation science and generating evidence for our practice, it's an ongoing process. Because what works today is not going to work tomorrow or the other day. So we really need to continuously provide evidence of why we do things the way we do them, and why two is better than one, to be able to really maximize and use the limited available resources logically to achieve the best outcomes. So thank you so much once again for hosting us today, and we look forward that we are going to have so many more sessions like this of discussing how we can really work together and this collaboration, and looking forward to hearing from everybody in the next session.
Absolutely. We will definitely welcome you back, because we want you to continue to dialogue on implementation science, so you can come and discuss some of the things that have been implemented, and that will be great.
Yeah, and sorry, we shall invite AOTIC and you personally to the African Echo,
yes.
especially, to talk about the opportunities that are in AOTIC, and how the African Echo participants can actively participate in the aims and the cause for AOTIC organization.
Absolutely.
Thank you, Annette. You actually took the words right out of my mouth. Serving in both groups, obviously, I would want more of an integration with AOTIC. And I really want to thank you for the platform, and just to share with our viewers that the African Echo, the Cancer Control Echo Hub doesn't talk about, actually addresses the entire problems within the cancer continuum spectrum. And so there's always something new to learn, always something new and interesting to hear about. And then it's a very great platform for knowledge sharing. We have people from diverse backgrounds share their experiences, some of the challenges and some of the innovative ways, strategies that they have used to overcome such things. And we also are very thankful to our international partners who have always provided technical expertise, and hopefully with you there, we hope to get a lot of people in the diaspora to partner with us. African community, we've developed to a certain extent. We have our capabilities are largely untapped, and we want to use this as a clearing point for others to join us as we further the cancer control efforts in our various countries. Thank you once again for the opportunity, and we really look forward to having you and more times in our forum.
Yeah, absolutely. Do you want to share how, most probably maybe your website or a contact person, and we will of course put it on the screen, but I'm not sure whether you want to just share how people can find out more about African Echo.
Well, I suppose we will be able to share that. We'll give that to you later, and then, you know, you can share that for us so that people know, are able to reach us. And then just to put out there that our meetings are usually on the first and the third Thursday of every month, and it starts at 3 p.m. West African time, and it's usually a one-hour event. Usually we have a case presentation on the subject matter, and then we have a didactic speaker who throws more light and brings up opportunities for advancing that particular topic of the day. So we'll definitely share the contact details with you, but suffice it to say that right now we meet 3 p.m. West African time on the first and the third Thursdays of every month. And we also have, occasionally we have breakout sessions where that don't exactly conform, because right now we already have a curriculum for the entire year. This was based on a survey that was done during the outgoing session, where people indicated areas of interest that they felt that they needed more information about. So we have the curriculum drawn out, but then when we have topical issues, we can obviously make our time and gather the ECHO community to be able to dialogue on such burning issues. A case being the use of smart technology right now in advancing cancer control program. We're having another meeting sometime this month, looking at how to use technology in early diagnosis and detection of cervical cancer in Africa.
Absolutely. Thank you.
Yeah, maybe to add on, I was trying to get the email contacts if they were to put on, but we have the African Cancer Control Researcher, the African Cancer Research and Control Echo Hub is hosted currently in Kenya with the Kenko organization. And our contact person is Christine. Initially, it was being hosted at the NCI Center for Global Health USA. But last year, one of the achievements is that we really successfully transfer the hub and the coordination to the Kenko in Kenya. So we are going to share our contacts, and they do all this work for us, the coordination, the recruitment of participants. If you have members, you really want to come on board and join. And if you have anything, you can contact the hub coordinator, who is Christine.
Absolutely, and we would put the information on the screen so that everybody can see the information on how to contact the African Echo and how to most probably reach out to them to collaborate. It is such a great pleasure hanging out with you two ladies and spending time to learn more about your organization. I am so proud of what you're doing for cancer control in Africa. This is really, really, really very important to be able to conquer cancer in Africa. So thank you for all what you do. I know you're wearing multiple hats, and I know it's it's tough as women to juggle.
Yeah, I know.
Many balls, but you are doing it with grace, and you're doing it with a smile on your face, and that's the most important thing. So thank you for joining us. To our audience, thanks for joining us today. Remember to subscribe to Aortic YouTube channel, and you can see the information on the screen. It is free. You don't have to pay a dime. And also consider becoming an Aortic member today. And please know that Aortic members are all over the world. So it's not only cancer clinicians or scientists in Africa. If you are, in anywhere in the world or in space, you can join Aortic. So consider becoming a member of Aortic today. Thanks for joining us, and until next time. Thank you and bye.
Thank you.
Thank you. Bye.
Bye.